Hemophilia and polycythemia. Hemophilia is a common hereditary blood coagulation disorder based on the deficiency factor. It is divided into two types: hemophilia A and hemophilia B. Hemophilia A, it is a sex-linked inherited disease. Male are affected while the females acts as a carrier. It may result from the spontaneous genetic mutation. The defect is due to either absence or low level or abnormal structure of factor 8. The clinical feature includes prolonged bleeding time, hematuria, and increased coagulation time. The activated partial thromboplastin time is increases. So the carrier female have reduced clotting activity. The treatment of hemophilia A can be done by replacement of factor 8 with factor 8 concentration or plasma cryoprecipitate. Hemophilia B, it is also known as a Christmas factor. It is due to the deficiency of vitamin 9. It is carried by the female and affects male. In case of hemophilia B, the activated partial thromboplastin time PTTK is raised. In severe cases, the whole blood clotting time is raised, but the bleeding time and the prothrombin time test are normal. Since the factor 9 is stable in stored blood, the treatment of hemophilia B includes the transfusion of factor 9 concentration or stored blood. Polycythemia. The polycythemia is also known as a erythropoiesis. This condition is indicated by raised hemoglobin PCV and red cell count. The value are above those normal for age and sex. The polycythemia condition can be classified as a relative polycythemia, absolute polycythemia. Relative polycythemia, it is caused by the decrease in plasma fluid part of the blood. The number of red cells in the blood is not increased, but the number of cells per unit volume of the blood is increased. This is observed in dehydration due to stress. The polycythemia, which is found in hand-working, hyperactive, middle-aged males. The RBC or normocytic morphology. White cells, red cells, and platelets are normal. The hemoglobin PCV and red cell count is elevated. The bone marrow is normal. Absolute polycythemia. The absolute polycythemia can be further divided into primary polycythemia and secondary polycythemia. The primary polycythemia, it is a chronic disease of unknown origin and found most often in patients over 60 years of age. In this case, the blood volume is increased while there are no changes in volume of plasma. The blood pressure is increased with elevated plasma platelet count. The RBCs are normocytic, normochromic. The occasional nucleated or red cells, immature granulocyte, and anisocytic RBC are seen. Increase in red cell count, hemoglobin PCV is observed. The bone marrow activity is hypercellular. Secondary polycythemia, it is caused by an increased level of erythropoietin due to a decreased capacity of hemoglobin molecules to carry oxygen. The hemoglobin in this case may be abnormal, and the tumor of liver, brain, and pituitary gland or renal carcinoma may be observed. It is often associated with respiratory failure and chronic heart disease.